Okay, this is joint splinting. First thing we want to do is make sure we have all of our equipment that we have. We have our cravat here, or better known as triangle bandage, in case you need that. We do have some roller gauze and some padding material here, some Coban, and then we have our splinting material as well. We're going to go ahead and immobilize the elbow area. First thing we want to do is make sure we have our PPE on. We're going to have a partner or something like that. Direct application of manual stabilization of the injury, securing above and below the side of the injury and maintaining that. We're going to go ahead and check that we do have PMS intact. Have them wiggle their fingers and maybe squeeze your hand, and also checking good pulse there. And then we want to go ahead and check our splinting material, make sure it is appropriate stuff, and put it in place. We're going to immobilize the side of the injury and then immobilize the bone above and below the injury. So our humerus and our radial and ulna, we're going to immobilize all of that. We're going to go ahead and let our partner hold on to that for just a second. We'll get this opened up, and we're going to go ahead and wrap it up real good with Coban, and using that to immobilize it. You can also use roller gauze if you need to, and if you do need to manipulate the extremity at all, you're going to make sure you have a couple people here to help you, and make sure that you're not actually manipulating the injured site. You'll want to do this above and below the injury and secure it real well. And you also want to make sure that, if possible, you can leave that injured site exposed. That way you can reassess it as you go, make sure there's no problems with that site. Once that extremity there has been immobilized, the joint is mobilized and everything's secured, you're going to want to go ahead and secure that to the body if at all possible. If we're on a backboard, we can go ahead and secure that arm and strap that arm down. We can use our triangle bandage here to go all the way around the abdomen and secure that arm to the abdomen and chest. If we need to do that, we'll do it. If we're able to actually bend the elbow, if the injured side is someplace else and we can bend that elbow, we can secure the patient's arm across their chest, and we can do that with the triangle bandage as well. And then once everything is secured and in where we like it and in the proper spots, we'll go ahead and recheck PMS, checking our pulses, have them squeeze our fingers, wiggle their fingers, make sure all that's still intact.